So, good evening, honorable members of today's sessions and audiences. I'm Kikuhata of Asia Cancer Forum. I'll be moderating session 4, Cancer and Sustainability. And today we're honored to have His Excellency Ambassador Keizo Takemi, former Minister of Health, Labor, and Welfare of Japan. And Ambassador Takemi, please give us a brief word.
Well, I'm Keizo Takemi, a member of the House of Council in Japan. But today, in this morning, I have just stepped down as the Minister of Health and Welfare and Labor. Therefore, today, I would like to utilize this occasion to explain the newly decided the global health vision of the Ministry of Health and Labor and Welfare of Japan. As you may understand, the Ministry of Health and Welfare and Labor itself has been very domestic-oriented. However, in this 1 year, during my period, quite successfully, I reform the basic posture of the decision-making within the Ministry of Health and Welfare and Labor. Therefore, just 1 month ago, the Ministry of Health itself, the historically first to publicize the global health vision. Therefore, this is a very, the basic new discipline of the Ministry of Health and Labor in the global health community. Now, I would like to introduce the purpose of this global health vision. The realization of the mission of the Ministry of Health and Welfare at a time when domestic and international issues are closely interrelated. The promotion of global health is of great significance from the perspective of the public health, diplomacy, economy, and security, as well as the stability of the international community, leading to protecting the people and contributing greatly to the national and the global interest. We have to focus on how the domestic factors and the global factors are mutually related to each other. And then what the role of the Ministry of Health and Welfare and Labor as a kind of a catalyst to create the two different factors under the one umbrella. Now, when we think of the catalytic role of the Ministry of Health and Labor, we do realize that the Japanese experiences in the past can be very beneficial for the other countries and the global health community itself. And how in the past we utilized only for the domestic purpose. How we can utilize those experiences and knowledge to the global health policy making and contribute for the health beyond the national boundaries. Japan's knowledge and experiences in the health systems and health financing can be utilized and shared with the international community. And when we think of those catalytic role, we do realize that we try to design the positive cycle in a better health and welfare that links Japan and the international community by contributing Japan's the rich experiences and knowledges in health and welfare to international community, and utilizing the insight and knowledge gained from international cooperation and exchange to the international community. This is an absolutely mutual benefit, not only for the people in Asia, but also the people in Japan can be very beneficial for those that knew the interrelationships and the function for the collaboration and the health policy making. Then, I would like to pick up the specific the subject in the whole picture. One very important new the challenge is the knowledge hub for UHC finance. This was originally adopted as the outcome document of the G7 Nagasaki summit in Japan last year. The thought of the knowledge hub for UHC finance has been consistently conducted by those of the Ministry of Health and Welfare and Labor, and also WHO and the World Bank. You can imagine that the World Bank is the largest donor in this global health community, and World Health Organization is the normative institute and leading those normative function in this global health community. The both has a very gigantic bureaucracy, but only Japan and the Ministry of Health and Welfare and Labor and the Ministry of Finance, they jointly take a very important initiative, go between those the gigantic, the global, the giant WHO and the World Bank for the same purposes. This knowledge hub for UHC finance consists of the three parts. The first part is for the training program for the government official in charge of the health financing. Most of them affiliated to the Ministry of Finance and also Ministry of Health. We will jointly invite those the government officials in the low and middle income countries to Japan and give them the consistent, those intellectual framework, how they can widen their own fiscal space. Widen the fiscal space in the low and middle income countries is the basic purpose to create the knowledge hub for UHC finance. As you may know, that we are having so many replenishment meetings in the near future. A replenishment meeting for the WHO, replenishment meeting for the Global Fund and Gavi Alliance, and CEPI. Those the replenishment meetings are taking place under, unfortunately, much more serious geopolitical circumstances. Under such circumstances, and also after the pandemic of the COVID-19, most of those the governments try to shrink back the size of the health expenditure before the pandemic happened. That sort of domestic political structure and also those of the international unfortunate the political conflicts are combining and create very negative political and economic circumstances under which we have to commit on those the replenishment meetings for the Global Fund, CEPI, and Gavi Alliance, and WHO. It seems to me very difficult. I don't think so easily to proceed the process to raise the financial resources for health through those other replenishment meetings. Therefore, this is a very important timing for the low and middle income countries to widen their own physical space and strengthen their own sustainability of the health system itself to achieve the universal health coverage. That's one of the most prioritized the purpose of this knowledge hub for the UHC finance. Quite luckily, the Japanese government and the Ministry of Health and the Ministry of Finance, they jointly take those initiatives to be the host of this very important subject. Only Japan can proceed those of the catalytic role, which can go between the Ministry of Health and Ministry of Finance. For example, when Japan was the host of the G20 Osaka Summit, it was the first G20 summit which organized a joint commission for the Ministry of Health and Ministry of Finance. Fortunately, after the G20 Osaka Summit, every year the host of the G20 continuously organized those the Joint Commission for Health Finance and the Ministry of Health and Ministry of Finance, and nearly institutionalized. The original idea and the basic initiative came from the government initiatives on the global health policy making. And the knowledge hub is one of those outcomes. And then the first part, as I mentioned, this sort of training program. One round have 2 weeks the training program, and we have 4 rounds a year. And now the Japanese government encourage the WHO and the World Bank to establish the joint curriculum committee and design the consistent training program for the both sides. And the next year, autumn, we are having the launching seminar for this knowledge hub of the UICC Finance in Tokyo. Japan, of course, as a host to start the challenge for the global health community. I would like to explain that the approach can be called soft governance approach. We are now trying to conclude the pandemic accord by the end of this year. But under the very difficult geopolitical conflicts, it's very difficult to build up the consensus among the member states. Even G20, it's very difficult. Therefore, those the very hardship, the leadership cannot be available under such circumstances. Therefore, we think we should create the soft governance approach, which can combine existing stakeholders under the one umbrella, the same purposes. Therefore, we utilize our collaboration with the World Bank and WHO at the global level, and at the national level, Ministry of Health and Ministry of Finance collaborate each other, and created those square collaboration system as a very inclusive. We are always should be very inclusive. That's the part of the second of this the challenge. Second part of the knowledge hub is to organize the UHC forum. UHC forum is not such a large size of the convention, like a PMAC in Bangkok and the Global Health Summit in Berlin. This UHC forum consists of only a top figure of the UN agencies and also the global health community for the UHC financing. Therefore, next autumn, we are having the first UHC forum as a launching seminar in Japan, maybe in Tokyo. And one of the purpose of this UHC forum is to prepare for the agenda setting to the next UN high-level panel for the universal health coverage in the 2027. This UN high-level panel for UHC can be a very important occasion to think of the post-SDGs, the post-2030, how we can redesign the universal health coverage as a target even after the 2030 is a coming very important subject for the UHC forum as a part of the knowledge hub of the UHC finance. And thirdly, the important part is the accuracy of the accountants of the budgeting system in the low and middle income countries. For example, the Global Fund and the Gavi Alliance both always utilize the matching fund system. Therefore, the 50% come from the Global Fund and 50% come from the recipient government. But in the real world, the Global Fund side cannot confirm to what extent really the recipient government contribute financially as the recipient government under the matching system because of the lack of those accuracy of the accountants of the budgeting system. Therefore, if we are having much more harmonizing the accurate the accountants of the budgeting system, this can be very important the leverage to widen the fiscal space of the recipient government in low and middle income countries. Therefore, the series of the targets has been already designed under the name of the knowledge hub of the UHC finance. And finally, I'd like to explain that Japan's new initiative for the Asian health. As you know, the elderly population over 65 will drastically increasing in this Asia and the Pacific area. Very speedy. Some countries' speed of the aging is much more speedy than the Japanese speed of the aging. And as a result of those of the speedy aging, we are having 70% of the elderly population over 65 will live in the Asia and Pacific by the 2050. As a result of those increasing elderly population, the demographic dynamics will bring about the changing of the disease structure in this area. Of course, infectious diseases are still very risky cause of death. But under such circumstances, it is quite obvious. Most serious cause of death come from the various type of the cancer. And the second is the ischemic diseases. And the third will be the stroke. And then we notice if some guys became a cancer patient and live in the Japan or Singapore or Hong Kong and Korea, those patients can receive the much more sophisticated healthcare services for the cancer patients and can survive and recover their own routine life and extend their own healthy life expectancy. But on the other hand, those the cancer patients whose the country has not such a sophisticated healthcare services cannot recover their own healthy conditions. As a result of such sort of the gap of the healthcare systems and qualities will bring about the health gap among the elderly population in Asia as a whole, by country. We can expect such sort of a disparity of the health conditions in the Asian countries in the future as a result of the aging. How we can prepare for those the unfortunate the tendencies and the changing of the disease structure is one of the priority subjects for us. And then Japan as the most advanced Asian country and possess those the sophisticated the healthcare services, and also those the academicians who has a lot of experiences to develop those the new the clinical services and the drug discovery. We can utilize those our own knowledges and those resources not only for the Japanese people but also for the people in Asia and the Pacific as a whole. In order to do that, what should be done? The one very important initiative has been conducted by the National Cancer Center. National Cancer Center established their own branch in Bangkok. This is the first branch of the National Cancer Center, having the branch in Asia and the Pacific. And also this year, Japan's FDA, the PMDA, launched their own branch office in Bangkok as well. Therefore, we can combine those the harmonization of the regulatory system and also the networking for the clinical trials under the one umbrella, and create those the networks in Asia and the Pacific. And under such a network, we try to transfer those clinical qualified services from the advanced nation to the low and middle income countries. Japan has already started this sort of a new initiative to overcome the future expecting disparity among the healthy condition of the elderly population in Asia and the Pacific. The cancer is one of the most priority subjects we have to jointly overcome. And Japan is now ready to prepare for how we can collaborate each other beyond the national boundaries, and also how we can transfer the new drug discoveries for the cancer patients in the Asian and the Pacific. I do hope that this very important symposium can contribute how we can jointly collaborate each other and overcome those the various cancer issues in Asia and the Pacific. This is a very valuable occasion to learn how to collaborate each other beyond the national boundaries. Thank you very much.
So thank you, Ambassador Takemi, for a powerful introduction on Japan's global health vision, as well as how Japan's Ministry of Health, Labor and Welfare and Ministry of Finance can contribute to the world, especially with regards to universal health coverage in Asia, and especially for cancer. Thank you very much once again. So now we have Professor Jeff Dunn, President of UICC, Union for International Cancer Control.
Thank you, Hara-san. Your Excellency, Dr. Katimi, thank you very much for that powerful presentation. I agree. Dr. Noda, Dr. Nakagama, Nori-sensei, thank you all for the opportunity to be here and talk with you today. It is a great pleasure for me as President of the UICC to spend some time with you talking about our activities and our plans and how they intersect so well with what we just heard from Your Excellency and other colleagues here in Japan. Of course, I'd like to begin by acknowledging with appreciation the work of UICC Japan. And I see out there Dr. Noda and others, and also the UICC Asian Regional Office, active in Japan for many years, who have made a great contribution locally, but globally as well. And I do thank them, and I acknowledge the Tokyo University for their cross-boundary research work, and some of the stuff, again, that Your Excellency spoke about there. It is truly a great privilege to be here and to share common hopes and aspirations about cancer control. A little bit about the UICC. The UICC is the oldest and largest global cancer organisation. It was established in 1933. It's a membership organisation with over 1,100 members, 60 partners, and it's leading the global action on cancer. That's the UICC's role. What makes us unique is that we're the only global organisation who focuses on all cancer sites, and we actually can connect with influential health leaders. And listening to that previous presentation, how important it is to be connected to influential people who can help us look at new, innovative ways to control cancer globally. I mean, we all know the challenges we face, and I am not going to spend a lot of time talking about the burden. We all know that the numbers of people getting diagnosed with cancer is on the increase. We know that the numbers of people dying from this disease is also on the increase. We also know that these increases and that cancer generally is not distributed equally. We know, for example, that by 2040, 70% of all cancer mortality will be in low and middle income countries, which presents us with the challenge, which is why closing the care gap has been such an important activity for the UICC over recent years. It's important that we understand that the benefits and the gains that we are accruing through our research, through our clinical practice, through our knowledge hubs, at this point in time is not being equally shared around the world, and this remains a priority for us. The mission at the UICC is to unite and support cancer organisations to reduce the global burden of this disease, to promote greater equity, and to assure that cancer control continues to be a priority on the World Health and Development Agenda. And again, if I can just remind each of us about the comments from His Excellency earlier about influencing global agendas, about the Global Fund, about the World Bank, about the World Economic Forum. They're some of about the UN, they're the agendas which we need to influence. The UICC membership, as I mentioned, is drawn from all categories of organisations, academic, cancer centres, cancer societies, researchers, universities, and the like. It's well represented around the world. Here's a slide with some of our members in South America, in Africa, and of course, importantly, in Japan, active and out there, working in the communities, making a difference. Our approach at the UICC is to support the cancer community globally and locally to drive global impact. We do this through a range of ways, which are about online learning, about grants, about fellowships, national advocacy support, patient group mentoring, T&M publications about tumour classification, access to events, and the like. So a range of benefits to members with a whole list of current learning and development opportunities. So part of our activity is about capacity building, ensuring that UICC members are well equipped and informed so that they can get about their business of cancer control in an evidence-based, concentrated and integrated way. Some of our particular activity about sharing knowledge. Many of you will know about the International Journal of Cancer, which is particularly important for us, and the T&M classifications. It's still the most sought after publication the UICC has, our tumour classification publication, and I know is well received globally, and of course over the years owes a great debt to many of our Japanese colleagues, researchers and academics who have contributed significantly. Key UICC events are about World Cancer Congress, World Cancer Leaders Summit, World Cancer Day, which I'll talk about in a little while, and certainly regional dialogues in the Asia Pacific and elsewhere. And we achieve impact through some targeted campaigns. The World Cancer Declaration, which is actually up for revision, and I'll come to that in a little way. The World Cancer Resolution, the global strategy to eliminate cancer of the cervix, global action on NCDs, another UN-related activity we must pursue together, and I will talk about that. The WHO's Breast Cancer Initiative and the Sustainable Development Goals. And we must deal with those as well. Current areas of focus for the UICC are on antimicrobial resistance, breast cancer, cancer and ageing, something Dr. Takemi spoke about, cancer and COVID as we emerge from a pandemic. We all know that we have a bottleneck, a built-up demand in our system now because of reduced pathology and testing and presentation during the pandemic. We're trying to work with that. Eliminating cervical cancer, the essentials medicine list, and try to ensure there's a more equitable distribution and availability and access for those medicines on the WHO essential medicines list around the world. And sadly, less than 50% of countries actually have access to the full range of those. Tobacco control continues, UHC, universal health coverage, and again, our appreciation to Japan for leading UHC knowledge hubs in the region. It will make a difference. Those things contribute greatly. And of course, investing in cancer control. So briefly, some initiatives. Over recent years, the UICC has launched a number of sister organisations. You will be familiar with some of these. The International Cancer Control Partnership, a collaboration. The NCD Alliance. UICC was a founding partner to look at NCDs, their escalation as a source of health-related burden around the world and the impact that it's having on cancer. The McCabe Centre for Cancer and the Law, leading the charge in how we deal with legislation around tobacco, around nutrition, around packaging for highly calorific sugar and beverages and food. And a recent one is ATOM, and you can see the slide there, which is access to oncology medicines, where we partnered and will continue to partner with the pharmaceutical industry to do what we can to arrange for access to affordable medicines in low and middle income countries around the world. And we're doing this through looking at innovative and new models of health financing, pharmaceutical models, to ensure that we get those medicines which we know can make a difference in people's lives, can improve survival, can bring down mortality, are available in low and middle income countries where right now they are too expensive. And we have been encouraged by the response from both government and in particular from pharmaceutical companies to join with us in looking at new models for development and delivery of medicines around the world. We have heard already about UN high-level meetings. There is one in 2025 to look at NCDs. It's an update meeting. The UICC, with our partners in other diseases, lung, diabetes, heart, are coming together and are presenting a united front at the UN high-level meeting on NCDs in 2025 to make sure that we maintain a global agenda about reducing NCDs. The contribution to the health burden around the world from NCDs is massive. It continues to grow. It is a major problem for cancer. If we're going to do something about cancer, we also in addition to looking at how we treat this disease and how we support people who are treated for it, we need to think about how we prevent the disease. And NCDs about physical activity, about nutrition, about all of those important things which might reduce our incidence of this disease are critical, and the NCD Alliance and the next UN high-level meeting on NCDs is critical to the sustainable approach of cancer control in the future. I mean, we know, all the evidence is out there now that 40% of cancers are preventable if we could just put into place our current evidence about prevention. So let's all come together for the UN meeting on NCDs. Another big issue for us has been and continues, this slide is about AMR, antimicrobial resistance. I have a few slides about that, but I'll work through them quickly. AMR is presenting as a great threat to cancer control globally. Right now, infection is the second leading cause of death in cancer patients after the cancer itself. AMR is a threat to cancer control. We need to identify that. And the UICC and our stakeholders and partners have just been, a slide about the impact, have actually just been in the UN right now. There was a UN high-level meeting on antimicrobial resistance just last week to talk about this disease and how we come together to manage it. Because if we don't do something about AMR, our ability to control cancer will be severely hampered. It is a crucial issue. It's one that's developing. And it's important when we think about sustainability in cancer control to remember to look outside cancer specifically. We've just spoken about non-communicable diseases and things about nutrition and exercise. We're now talking about infections and antimicrobials and their importance to cancer control. We need to look at our environment and what's changing. And our reliance on antimicrobials in health and in pharma, in agriculture and in animal husbandry over the years has diminished our ability to deal with infections, which severely compromises our capacity to manage cancer. Just in the past week, and again speaking to the importance that Japan plays in our global and regional cancer control effort, the Quad collaboration, America, Japan, India and Australia have announced a partnership to support the global elimination of cervical cancer, but to focus first in the Indo-Pacific region. The UICC is delighted to be a partner in that Quad announcement. The UICC is leading the civil society arm of this Quad arrangement to look at, what would be a monumental thing. Imagine, if you will, that we can eliminate cervical cancer. 5-10 years ago, that would not have been a possibility, but we've come together. We have the evidence. We have the technology. We just need to work together to deliver on this. And through that Quad arrangement and through our research partners, we must not miss this opportunity. For the past 3 years, the UICC's World Cancer Day in February 4 has focused on closing the care gap. As I mentioned earlier, we know that the benefits of our research, our knowledge, our clinical practice are not shared equally around the world. There are care gaps. And the first year of our Closing the Care Gap campaign was about focusing on the problem, making sure that it was evident people understood. The second year in 23 was about bringing our voices together, encouraging people to take action. And of course, last year was the third year of the campaign where we challenged those in power to actually take action, to do something, to use their influence and their position to make a change. I'm delighted in this session again to hear His Excellency talk about some of the things have been happening here in Japan, and I can tell you around the world, activities which have been directly targeting closing the care gap, and it has been a successful campaign. 2025, we start a new World Cancer Day campaign, and it is titled United by Unique. its focus is on the actual important patient-focused empathy and compassion at the centre of how we approach cancer control. Keep an eye out for the new World Cancer Day campaign, United by Unique. And I think the two words are important for us. We do need to unite, as Dr. Takemi mentioned at the end of his presentation. Together, we need to unite to make a difference. And each of us are unique and each of us have a role. Our ability to tackle cancer control in a sustainable fashion will be a function of that. We do need to partner for success. None of us can do it alone. Whether it's through the Quad partnering, whether it's through Japan partnering with regional countries, Thailand, for example, knowledge hubs for UHC. We need to partner for success. Cancer control is going to be done through collaboration. And through the UICC, it is one of our great privileges and our mission to bring partners together, and we have many. There are just some examples. And we need to drive the global agenda through the UN, through the World Bank, through the World Economic Forum, through the Global Fund, through Gavi, through wherever it is that we need to make a difference to improve cancer control. Because sustainable cancer control, in time, is going to require all levels, all stakeholders, all countries to come together to collaboratively make a difference. We need to improve equity in cancer control through highlighting the issue of inequity, through fully funding national cancer control plans. These are the things we need to do to make sure we've got access to medicines and to increase awareness, increase access to technologies where they're not equally shared, like radiation therapy, and in some cases surgery in LMICs. We need to ensure that cancer remains a priority on the global agenda. We have spoken about that. Cancer is the second largest killer globally. The burden is growing. Global commitments are required. We have already heard from His Excellency about that and how important it is. But we need to push for that. We need to advocate. We need to apply pressure. We need to provide argument. We need to focus on the new set of Sustainable Development Goals for 2030. Many of us were involved in arguing for the last set of Sustainable Development Goals to include reference to health and cancer. We got a reference, but in 2030 we need more. And again, together, let's ensure that cancer appears as something which is critical to sustainable development globally. Let's make sure that universal health coverage is not reported as a cost center in our finance budgets around the world. Let's see if we can make it get reported as a profit center. Because with universal health coverage properly in place, we are more healthy, vibrant, productive communities. Let's think about how we message these things, and let's make sure that the World Health Assembly resolution on cancer will inspire community to hope more and to act more. No single sector organisation can address cancer control alone. It needs to be multi-sectorial, and the UICC will continue to play a role in bringing people together, to making sure that we do whatever we can to enhance global partnerships. The private sector play a role. Partnerships like the ATOM Coalition with pharmaceutical companies. And while as an organisation we believe in collaboration across different diseases and sectors, we need to actually make sure that we have surveillance very broadly across the community, across what's happening, across technology with AI, and we've heard a presentation today. All of these things present both opportunities and potential threats for us as we look at how we might make sure we take a sustainable approach to cancer control. And in terms of health funding, yes, we need more health funding, but we need to look at innovative health funding mechanisms. How do we transition existing health funding means and models into ways which are sustainable, into ways which are attractive to governments by and large, and in ways which deliver outcomes? These are some of our challenges into the future. The World Cancer Declaration is up for renewal. We are in the process at the UICC of doing that just now, Member organisations were encouraged at the UICC World Cancer Congress just 2 weeks ago to start contributing to what the new World Cancer Declaration will look like. We are encouraging you to participate. There will be opportunities, and we will write to you about it, to make sure that we hear every voice, to make sure that we update the World Cancer Declaration in ways which reflect the global community. Let's make sure that it's fit for purpose to deliver on sustainable cancer control. Critical initiatives, we've got about collaborating, that's for us. Engaging with UN organisations and control communities, consulting with industry stakeholders, cancer patients and their groups, encouraging and enabling governments, partnering with organisations, and inspiring the cancer control community to come together, to collaborate, to make a difference in cancer control. A couple of key upcoming events I bring to your attention. The next World Cancer Leaders Summit is in my home country in Australia. It's in Melbourne in November 2025. I do encourage you to come along and participate. Australia, of course, is a good friend of Japan, and we value that relationship. We are now linked through the Quad Partnership in cancer control and the UHC knowledge hubs that we have already heard about. We need to expand. We would love to be partners. Please come with us. Now, the theme for the Melbourne meeting is Bridging Divides and Building Futures. And we will collaborate on that with a particular focus on the Asia-Pacific region. And the next World Cancer Congress in 2026 will be in this area, in Hong Kong. We were delighted to announce it. So it will be in September in Hong Kong. Please put that in your diary. Let's make sure we have a terrific turnout from the Asia-Pacific region. Sustainability, finally, sustainability in cancer control is not up to one person alone. We need to look at surveillance and monitoring. What are the opportunities? AI. What are the opportunities? Coming together and collaborating. Some of the threats about AMR and other things. We need to work together. We need to invest in those things we know that work and prioritise those things where we'll get best return on investment. Perhaps a greater focus on prevention and early detection to deliver better long-term outcomes and greater quality of life for community. We need the evidence. We need the evidence. We need the evidence, and to the researchers and clinicians out there, thank you for what you do. Let's get the evidence. Let's find out what works, and then let's collaborate and make sure we share that globally to make a difference for everyone out there, not just for those in pockets. Let's look to the vulnerable. Let's advocate continually at a local level, at a regional, a national regional level, and at a global level. We must push that. We must educate. And finally, my message for all of us is that there is a role for each and every one of us, no matter what we do. Clinician, advocate, allied health professional, nurse, official, fundraiser, broadcaster, journalist, poet. Whatever we do, we all have a role. Please bring that to bear. Let's put it all on the table. And together, let's make sure that we deliver a sustainable approach to cancer control. Ladies and gentlemen, thank you very much for your time today. I do appreciate it.
So, Professor Dunn, thank you so much for your inspiring, intriguing, forward-looking presentation on cancer control. So today, unfortunately, Dr. Murali cannot make it due to government circumstances. So we're delighted today to have Mr. Isobe of Sumitomo Corporation to talk to us about Sumitomo's engagement in Malaysia.
Thank you for this opportunity to talk about this topic in front of very important people in this industry. I'm from Sumitomo Corporation, and it's a private sector company. So today I will mainly talk about our Malaysia business. So it's going to be one example in this field. So first, I will briefly introduce about Sumitomo and the Malaysia healthcare overview. And after this, I will also talk about the concept of managed care, which is our business in Malaysia. And next, I will talk about PM Care, which is our group company who is doing this managed care business. Just briefly about myself, I joined Sumitomo Corporation in 2006, and after several assignments, I moved to Malaysia in 2019. And after 5 years of working there, 2 months before, 2 months ago, I came back to Japan. So this is some of the pictures of my Malaysia life. So I was able to mingle with Malaysia colleagues and was able to understand their culture, their way of business, their thinking. So it was very precious memory for me. So, for example, in 2019, I completely didn't like durian, but after 4 years, I love durian now. Okay, let's talk about Sumitomo Corporation. So, Sumitomo, as you may know, it's an old Japanese brand, which was founded in 17th century, so it has 400 years of history. And now it was diverged into a conglomerate company. And now we have 80,000 employees all over the world, and slightly less than 900 group companies are in the world as well. Okay, and this is the company I'm going to talk about today, which is called PM Care, which was founded in 1995 as a pioneer and the leading managed care organization in Malaysia. And now it has very wide-ranging of features, including digital platform, big data analytics capability, and healthcare solutions. And on the right-hand side, it's a list of clients. Most of the major Malaysia companies are with PM Care. Okay, let's look at Malaysia healthcare system overview. It can be divided into two. One big half is the public sector, and the other one is the private sector. And the healthcare expenditure is almost the same. And the public sector, it's working something like a safety net. So if you go to a public hospital or public clinics, you only pay very cheap amount, let's say $0.2 or something like that. But there's a very long queue, so it's a overcapacity issue, actually. Sorry, and on the right-hand side, the private sector, the price is much more than public sector. And when we look at the number of visits, for example, outpatient, 60% is handled by public sector, and 40% is private sector. And when we look at secondary care and tertiary care, the 77% is handled by public sector, and 23% is handled by private sector. As you can see, there's a big disparity between public sector and the private sector. So there's an overflow of patients in public sector. Another issue of Malaysia healthcare system is the prevalence of non-communicable disease. This is the top 10 cause of death in Malaysia. And 8 out of 10 are from non-communicable disease. And number 7 and number 8 are cancers. Another issue is about obesity. Because of the culture, because of the food. Unfortunately, when we look at ASEAN countries, Malaysia is the worst country in terms of obesity. And at the same time, when we look at the cost side, the healthcare cost inflation is one of the highest in ASEAN countries as well. For example, when we look at 2023, right, Malaysia healthcare cost inflation is about 14%. And in the last 5 years, when I was in Malaysia, it's actually more than 10% every year. So it's a huge cost burden to public sector and the private sector. Of course, Malaysia government, they are trying to improve this situation. And when we look at the white paper issued by Ministry of Health, Malaysia, they established 4 pillars to improve this situation. I will just briefly introduce those pillars. Number 1 is about transforming healthcare service delivery, which is actually including the utilization of digital technology, like electronic medical record. Pillar number 2 is advancing health promotion and disease prevention. I'm very happy to hear those emphasis on preventive care in Malaysia. And pillar number 3 is about ensuring sustainable and equitable healthcare financing. And pillar number 4 is about strengthening the foundation and governance of the healthcare system. So Ministry of Health itself, they are transforming themselves to have more role in the healthcare industry. And is there any solution we can quickly start in private sector? Of course, as I said, government is trying to improve this situation from their angle. But myself, as a private sector person, what can we do, right? So, and there's an issue like increasing NCDs, escalating medical costs, growing needs for digital health or mental health. And what Sumitomo Corporation we are doing is the managed care solution for corporate workers and the dependents. And when we ask what is managed care to ChatGPT, they reply his answer like managed care in the United States is a healthcare delivery system organized to manage cost, utilization, and the quality. And this approach is primarily in healthcare maintenance organizations, HMOs, and preferred provider organization, PPOs. And the key characteristic includes provider network, emphasis on prevention, gatekeeping, cost control, and quality oversight, and restriction on coverage. Overall, the goal of managed care is to provide quality care in a cost-effective manner. So this is the some definition of managed care. And what we are doing in Malaysia, let me talk about this. In Malaysia, without managed care organization, this is the situation. There is a payer like corporations or private insurance companies. And there's a provider like hospitals or clinics. And without us, right, those patients, they just go to hospitals and the clinics. And there's, it's actually a non-controlled environment. The payer, like HR of the corporation, they don't know where their employee went actually, or what kind of a disease they got. And the cost information is almost very unclear because there's no system to inform them actually. So what we are doing here is like a middleman between payer and the provider. And first, we form a network of providers. We call it provider network. And we have a specific agreement between managed care organization and the providers about cost or about the coverage. And after this, the employees or dependents of the payer corporation, when they go to network of providers, they get treatment without any payment within their coverage, right? And those providers, they submit medical bill or medical claim to managed care organization. And we adjudicate it, and we ask payer to pay to us, and we pay back to providers. And in this course of transaction, we are able to know who went to which hospital for what diagnosis and what medication was given. And a lot of data was accumulated. So we leveraged those data sets to develop all the preventive care service or the necessary service for the employee of this payer. And we provide healthcare management service, comprehensive service to the payer. So this is the types of data we obtain. Age, gender, ICD-10 diagnosis code, claim amount, or the provider information, And we are slowly gathering more information about EMR or any other blood testing results. And by utilizing those data, we do all the analysis for the population health of this particular organization. So, for example, if we do some sort of a risk stratification to segmentize the people in the organization from high risk to middle risk to healthy, and we can plan the appropriate plan to each segment. For example, if there's a chunk of people with very high risk, we can do a health intervention program to improve their health situation as well as controlling the cost for the payer. Those are the health awareness event webinars we do for the payer corporation, health screening events, and we do provide data analytics health screening result reports to the payer. Those are the just example. And we also adopt digital technology to do teleconsultation, e-pharmacy, medication delivery service. We launch mobile app to increase the touch point with the individual patients. And we introduced patient navigation mobile app for the patient to make informed decision. And this is the last slide, the ecosystem we are trying to establish in Malaysia. So we are here as a managed care organization. And Sumitomo Corporation, we run the biggest GP clinic chain in Malaysia. So we do a proper collaboration, coordination with the provider side to provide best healthcare management service to the payer and the patients. So that's what we are doing. Thank you very much.
Thank you, Mr. Isobe, for your very insightful introduction on healthcare in Malaysia. So we'd like to have a brief panel discussion. And we'd like to ask Your Excellency, Ambassador Takemi, Professor Dunn, Professor Iwasaki, Mr. Isobe, and Mr. Sakano to come on stage now. So thank you all for coming. We have very, very great guests tonight. But we only have a very short amount of time for this panel discussion. And unfortunately, or fortunately, we have a very big topic, which is cancer and sustainability. But it's interesting because we have 5 panelists from very different backgrounds. His Excellency is from the government and lawmaking side. Professor Dunn is from the international organization as well as the academia side. Professor Iwasaki is from the academia and research. Mr. Isobe, who just talked, is from one of Japan's largest conglomerates. And Mr. Sakano is from Japan's leading medical DX company. So would it be possible for me to sort of point to different people to ask on how maybe we can all collaborate from, we're coming from all different sides, from the government, from lawmaking, from international organization, from local companies, academia. But, from your different speeches, we heard about, having a partnership, collaboration, and on how to contribute to, how Japan can contribute to Asia, especially in terms of cancer. So maybe we can start with Your Excellency.
It's really a big question. When we design those the structure of the collaboration for those how we can cope with those increasing risks of the cancers, various cancers in Asia and the Pacific as a whole, I can say that the public and the private partnership is one of the key. But on the other hand, we always have to think what sort of role of the government we can expect. In Japan's case, Ministry of Health and Welfare and Labor are mostly very domestic oriented, and they possess so many resources and knowledge. But in the past, only mobilized the knowledge and the resources for the domestic patients only. But how we can transfer those the structure and the system can be more inclusive, and how we can collaborate with the other potential partners, and public and private both. For example, I can say that we are now having the increasing size of the inbound foreign patients. The last year, we have 1,600 the patients, foreign patients, who possess the medical visa. And this trend has been increasing in the very drastic. But how our side can receive those of the foreign patients in a Japanese hospital? This is an increasing subject under the public and private collaboration beyond the national boundary. Also, I would like to say that the role of the government is sometimes decisively important. I mentioned that the National Cancer Center now has its own branch in Bangkok. And the National Cancer Center concluded the MOU with the Ministry of Health in Thailand, and the medical doctor Japanese medical doctor in Tokyo National Cancer Center can commit on the diagnostics and treatment for the clinical trial patients in Bangkok. At that time, the Ministry of Health of the Thai government temporarily give the medical doctor's license to the Japanese doctor through those the online diagnostics and treatment. Without government permission, we cannot design the process of the clinical trials beyond the national boundaries. Therefore, the harmonization of the regulatory system and also the networking for the clinical trials, and also we have to think that how we can overcome so many the obstacles such as the license of the medical doctors and the nurse. Therefore, the role of the government is decisively important to encourage for those the collaboration of the public and private partnership. Thank you.
Yes, thank you, Your Excellency. You mentioned about the decisive importance of the government role and about the cross-boundary collaborations between different governments, especially, for example, clinical trials with Thailand. Very intriguing. Now, I'd like to ask Professor Dunn, how would, for example, UICC collaborate with the government of Japan, as well as the Japanese companies like the conglomerates and the tech companies, as well as maybe possibly the academia? You have, from my understanding, UICC has like a different types of touch points with different partners. How would you view your partnership with those?
Thank you, Hara-san. Can I begin by agreeing 100% with His Excellency? It is about understanding your role. And governments have a role, and it's a critical role to play. Civil society has a role. Industry and pharmaceutical companies have a role. And while they're different, as His Excellency said, they are all intertwined. So it's understanding what your role is, and then looking for ways to bring those together. For example, researchers and academics can draw the link between physical activity and cancer risk, or physical inactivity and cancer risk, or between poor nutrition and cancer risk. But then it's government we need for policies. It's civil society we need to advocate. And together it's a mechanism which can work. I think in many ways what we need to do is look at innovative ways to provide channels for contribution. So innovative funding models and mechanisms for pharmaceutical companies. I mean, pharmaceutical companies, by definition, need to make a profit. That's what they're there for. But how can we get them a profit at the same time as getting affordable drugs and access to those things in low and middle income countries? And they're the sort of things that the UICC does. We look to bring people together, find ways to connect and then look for innovative mechanisms to deliver on outcomes consistent with role. Because the minute civil society tries to act like government, we're in trouble. And I think government needs to do what government does best. But there are ways, Hara-san.
May I ask Professor Iwasaki about how the academia as well as hospitals can, for example, contribute towards both within Japan and for Asia? For example, His Excellency talked about, foreign patients coming to Japan using medical visa. And earlier today we had, different talks on closing the gaps between, the cities and the rural areas and between countries as well. Could you maybe talk from your own experience or your vision?
Hoto-san, thank you very much for your comment. As a member of academic side, I would like to mention about the medical collaboration between the Asian countries, and maybe we can have several issues, several things which we can contribute for the closing the cancer care gap. But I think the value of Asian collaboration is not only this kind of the medical collaboration. Asian country has a greater value for the generation of the very important data which is needed for the future drug. As Takemi-sensei mentions, the collaboration with the Asian countries is a very good basis for the large size clinical trials, which may generate very clear medical evidence. However, we have to investigate the more basic side, and for example, in the genetic factor for each countries. And National Cancer Center initiative is doing this kind of the basic research. And by the collaboration of the Asian country, Asian patient, we can accumulate more reasonable, more valuable genetic data, which is a basis for creating the future drugs, which is more appropriate for the Asian cancer patient. So this is, Japan has, I think, say, National Cancer Center as well, and also other academic people can have a role to contribute this kind of the generation of new drug together with Asian leaders, Asian specialists, and of course, Asian patients. So those kind of the whole Asian countries collaboration may be a very nice the basis for the generation of not only just a medical care, but future medical care. So I think from the academic side, and I'm deeply involved in the drug development, I have a great expectancy of the Asian collaboration for generation of the new drug, which may definitely contribute the future, brighter future of it. And this is not only a cancer field. Other non-communicable disease, and as Jeff mentioned, AMED is one of the very important issues globally. And this kind of the system can do a lot of things for the creation of the future drugs.
Okay, thank you, Dr. Iwasaki. Now I'd like to ask Mr. Sakano. Okay. I understand you come from a very techy side, but at the same time, you've been involved with many government projects as well. And two questions. One, how do you visualize your company involved, in your involvement with Asia and cancer? And two, how do you visualize your future partnership, for example, with the UICC or the government or the conglomerate or, the research or hospitals, like the other industries maybe? big questions.
But anyway, thank you for this opportunity and for this question. Yes, this is a very difficult topic. But from private sector, we see this as a big opportunity. It's a huge opportunity. But to succeed, we need a deeper collaboration. And I think we are all looking at the same target and the same goal. We want to make a contribution to the healthcare market and want to contribute to the people in Asia. But we also have another motivation as having the multiple stakeholders. So we need to come up with we do have a common goal, but the approach is we need to consider about each individual and each stakeholders' motivations and such. But from a Japanese private company's perspective, Japan is a aging society, and as everybody is saying that the market itself is shrinking and such. But if we see this as a Asian market, it's rapidly growing, and at the same time, this is the only very fast country that over 1 million population that the UHC has a full coverage to each individuals, plus not only the medical but also the nursing and the caregiving. Japan has continuously adjusted the system and policies continuously, and this experience and all the data, I think we can make a very clear contribution to the Asian market. And so we did not only succeed, but our experience of making the failures, I think that can also be as a knowledge we should be sharing in the Asian market to see how the same common goal, and looking at Dr. Yasaki mentioned, looking at the bright future and the potentials.
Thank you, Mr. Takano. And last but not least, Mr. Isobe. Welcome back to Japan, first of all. And now you're in the so-called, overseas healthcare unit, I guess. And I'm wondering whether you're seeking to sort of duplicate your, for example, Sumitomo's endeavors in Malaysia, in other Asian countries, or are you thinking of diving into new, ventures and endeavors?
Thank you. Thank you for the question. To simply put, we try to replicate our Malaysia case to other Southeast Asia countries. So, such as Singapore, Indonesia, Philippines, or Vietnam. Actually, we do similar business in Vietnam as well. So that's our expansion plan.
For example, Sumitomo Corporation, of course I understand that it has a long history of working with the Japanese government. But how about, for example, is your company thinking of making more partnership with UICC and international organizations, or deepening ties with the academia, or involving many tech ventures? Or
yes, actually, I agree with the importance of public sector, private sector collaboration. Oftentimes, when I was in Malaysia, I encountered the situation like the health screening or cancer screening take up ratio very low, actually. And those HR who are supposed to maintain the health of employees, sometimes they weren't aware of the importance of health screening. So if those partnerships, the private sector, public sector, exports the concept of Kenko KA or healthy management of the company to those countries, and if there's a public concept of those healthy management of the company installed in those countries, then it's easier for us to convince those companies, HR, to increase the take-up of the health screening, and which is actually good for everyone, good for employees because of the early detection of the cancers or any other maintenance of the health, and of course it's good for company as well because of the healthy employee is a productive employee, and for us, a private sector company, we can also find the business opportunities as well. So I believe we hope we can do this kind of collaboration.
Thank you, Mr. Isobe. We're kind of running out of time, so maybe could we have a short final remark from His Excellency? And after that, we'll have a closing remark from Professor Iwasaki. So first, could you have a word from Your Excellency?
As I mentioned, everybody noticed that the partnership and the collaboration among the public and private, the stakeholders are very, very complicated. And also, each country has a different regulatory systems. And without those harmonization of the regulatory systems, I don't think we can easily to build up those the system of the collaboration. In this context, I can say that the role of the government is sometimes decisively important. And in addition to that, the market mechanism is another very important place for the collaboration. The Japanese companies has already started to invest into those the healthcare services. For example, the Mitsui Bussan maybe invested quite a lot in the Singapore, the large fund which has invested in the healthcare services, not only in Singapore but also in Malaysia. On the other hand, several Japanese companies are directly created their own the hospital and the medical supply systems in India and sometime in Vietnam. But always they are facing so many difficulties through the community health care services in each country. How to collaborate with the other medical suppliers in each recipient country is a decisively important factor for the investment in the Asia and the Pacific. Maybe the government and the private sector should much more closely collaborate with each other and confirm what sort of difficulties we are having, and then try to design how to overcome the difficulties with our potential partner of the other government and the private sectors. But once again, I would like to mention that such sort of challenges are really, really difficult and very, very complicated.
So thank you, Excellency, for your very, exciting vision with different challenges, but promises as well. So please let us give us applaud to the 5 panelists. Now, thank you very much.